Social distancing is something we are all forced to get familiar with in this climate of the COVID-19 pandemic. Health officials stress the move is one they hope will reduce the number of cases. Pan American health officials provide an explanation on why it's necessary at this time.
Only methods that are available to us to interrupt transmission are tried and true public health measures. The social distancing is really aimed at reducing the risk of exposure to infected persons. So by, for example, closing schools, we reduce the possibility of children being together in one place, and if one person is infected, infecting several other persons.
Pan American Health Organization and World Health Organization country representative Dr. Esther de Gorvel says social distancing is one way of reducing the spread of the COVID-19 virus. It's something health officials consider tried and true. With persons operating still in this environment of emergency protocols activated, the advice is to stand at least 3 to 6 feet away from another person. Dr. de Gorvel explains how the virus is transmitted.
It happens usually from symptomatic persons who are exhibiting signs of cough and sneezing perhaps, fever, and they may also have shortness of breath. When you are in close proximity with such persons, infectious droplets that come from the nose or mouth may be projected onto the surfaces, for example, of tables, of desks, of telephones, and if you are coughing and not practicing cough etiquette, it may be transferred onto your hands.
Health authorities say one infected person can infect 2.5 people. That can potentially affect more than 500 people in a month's time if no protocols are adhered to. However, social distancing can reduce those numbers to possibly 15 people or fewer than 2 cases.
If you are in the presence of someone who is infected with COVID-19, exposure does not necessarily lead to infection. So some persons who are exposed may become infected, but others may remain asymptomatic and not have the disease. We don't want to play Russian roulette, however, and this is why we're asking people not to congregate together to reduce the risk of exposure, because we don't know who is going to become infected.